Hi guys, Brittany Macias here, and on today's episode of Teach Me ABA, we're going to be discussing the 6 common misconceptions in ABA. You've heard this a lot of times growing up. You can't eat and then jump in the pool because you might get a cramp or something like that. Well, this is a misconception. So what are the kinds of misconceptions that we have in the field of ABA? That's a good question. Let's see what we have. First one, punishment is used. Number 2, reinforcement is bribery. Number 3, one program suits all of our clients' needs. Number 4, ABA just looks like the therapist is playing with my child or loved one. Number 5, ABA is too new of a therapy to actually work. And last but not least, number 6 is that ABA is only used for children. All right, let's break this down a little bit. For the first one, punishment being used. Well, truth be told, punishment is actually used when all other programs have been utilized. Programs specifically gearing towards reinforcement. So as soon as we've noticed that reinforcement doesn't work for your loved one, then we're going to move on to punishment. And although the word is scary, it doesn't necessarily mean that we are, laying a hand on your loved one or we're causing severe emotional pain. Although it might look a little bit distressing, we'll do maybe a slight punishment program, if need be. Again, this is always going to be a last resort. And any program that involves punishment should be really discussed with your board certified behavior analyst, your BCBA, whoever the program manager is, or even if you have questions, it's a really good idea to just bring it up and see if it might be something that will help your loved one decrease those problem behaviors and maybe increase the good behaviors, which is exactly what we want to see. According to B.F. Skinner, that although punishment, you might see a quick change in behavior, in the long run, it's not going to improve the overall behavior of your loved one. On to the next misconception, reinforcement as a way to bribe your loved one to work with us. So what's really happening here is that we are building up the reinforcer or the preferred item of your client or loved one, and we're using this so that your loved one or client will work with us. So it might look like we're consistently giving little Timmy a piece of candy, and all we're doing is maybe looking like we're feeding them fatty foods or something like that, which of course is up to the discretion of parents. What we're really doing is just building up motivation so that we can get lessons done and that they're more eager to work with us every day. Any reinforcement schedule or reinforcer or reward used should be discussed with the parent or caregiver, because eventually we're going to want to thin that reinforcement schedule and then we'll completely get rid of that item or object or maybe even food. On to the next. One program suits the needs of every client or loved one. This is completely untrue. So what really is happening is that we're doing a lot of interviews and we're doing a lot of assessments so that we can understand the skill set of your loved one or your client. So really we're going in and every program is going to be uniquely different to each person. ABA therapists are just playing with my child. So this is actually another misconception that's really untrue. Although it may look that the therapist is just having fun and playing with their toys with your child and just looking like it's just playtime, truth be told, we're just pairing that relationship so that your client or your loved one will be more likely to play with the therapist. At the end of the day, what's really important is that your loved one or your client wants to enjoy the time with the therapist and at the same time not realize that they're learning something every single day. ABA is too new of a therapy to actually work. Truth be told, ABA is about 50 years old. And any program that we do has been research-based and has been tested. Last misconception is that ABA is only used on children. As a matter of fact, at Piles & Associates, we have an adult division and we have a child's division. So really, ABA can be used at any age or at any skill level. So thanks for taking the time to watch the video. Once again, this is Brittany Macias for Piles & Associates. This episode of Teach Me ABA was titled 6 Common Misconceptions of ABA. Please go ahead and subscribe or like the video.